Today we'll be talking about intrathecal pump, which is a pump that's implanted and has a catheter connected with intrathecal space where it delivers medication directly to the intrathecal space. So the benefit of using the pump is that we use a small amount of medication to bring up the same effect that we have to use a large amount to take it orally. So we use less amount, and the second is less side effect from the medication because we're basically using less strength of the medication. The intrathecal pump is used for patients with chronic intractable pain, that they having pain so severe and not relieved by any medication and by any other intervention, and they become using a high dose of narcotics, and the dose of narcotic are escalating, and they start suffering side effect from this amount of medication. At this point, we offer the patient to use the intrathecal pump. The pump is implanted where an incision is made in the anterior abdominal wall, and the pump is implanted in subcutaneous tissue. There is a catheter connected to the pump that goes into the intrathecal space, and the pump is secured in place. And at this point, the incision for the pump is closed after everything is connected. The pump is a referable pump. So some pumps, there's two volume of pumps. One is 20 cc and the other one is 40 cc. And it depends on the usage of the medication. If patient is using medication a lot, we use a large volume pump, which is 40 cc. Otherwise, we'll use a small volume pump. The pump is refilled on a monthly basis or every 2 months. Again, depends on the amount of medication used by the patient. And the refilling of the pump occurs through the skin. So the pump is already implanted on top of the skin. The refill happens through the skin.